Measles is a highly contagious infectious disease, caused by the measles virus. It is also known as rubeola. Not to be confused with rubella, German measles, and roseola, which are different diseases, caused by unrelated viruses. Symptoms usually develop 10 to 12 days after exposure to an infected person, and last 7 to 10 days. Initial symptoms typically include fever, often greater than 40 degrees Celsius, 104 degrees Fahrenheit, cough, runny nose, and inflamed eyes. Small white spots, known as Koplik's spots, may form inside the mouth, 2 or 3 days after the start of symptoms. But the classic sign is a red, flat rash, which usually starts on the face 3 to 5 days after the start of symptoms, and then spreads to the rest of the body. About 7% of cases have complications, including diarrhea, middle ear infection, and pneumonia. Less commonly, seizures, blindness, or inflammation of the brain may occur. Measles is an airborne disease, which spreads very easily through the coughs and sneezes of infected people. It may also be spread through contact with saliva or nasal secretions. It is so contagious that a single infected person will spread it to 9 out of 10 non-immune people who live with them. One reason is that it can be spread 4 days before a rash develops, and continue for 4 days after the start of the rash. Fortunately, most people do not get the disease more than once. Testing for the measles virus in suspected cases is important for public health efforts. The measles vaccine is effective at preventing the disease, and is often delivered in combination with other vaccines. Vaccination resulted in a 75% decrease in deaths from measles between 2000 and 2013, with about 85% of children worldwide being currently vaccinated. Once a person has become infected, no specific treatment is available, but supportive care may improve outcomes. This may include oral rehydration solution, slightly sweet and salty fluids, healthy food, and medications to control the fever. Antibiotics may be used if a secondary bacterial infection such as bacterial pneumonia occurs. Vitamin A supplementation is also recommended in the developing world. Measles affects about 20 million people of all ages per year, primarily in the developing areas of Africa and Asia. It is one of the leading vaccine-preventable disease causes of death. In 1980, 6 million people died of it, but by 2014, global vaccination programs had reduced the number of deaths to 73,000. Rates of disease and deaths, however, increased in 2017 due to a decrease in immunization, and may be as high as 10% in people with malnutrition. Most of those who die from the infection are less than 5 years old. The overall risk of death among those infected is about 0.2%.